So now we're going to discuss drawing labs on your CV patient. Once your secondary person has got your swan taped, during that time as well, the secondary is responsible for checking your NG tube, making that it's in place, and then call an x-ray. And now we're going to get ready to draw our labs that we need. The secondary person will draw, like I said, you'll get your BMP, your CBC, and your coags, okay? This is a bloodless medicine, a needleless system. So what you do, you will pull back on your plunger, and it has a little click to it, and you can kind of hear it. So once you pull back, typically you'll waste about 10 cc's of blood, and then you'll turn your stopcock off to your flush right here, okay? Because you don't want your sample to be diluted in any form, okay? So also, we just remind you guys, always make sure that you're drawing from your port closest to your patient, okay? You'll clean it with your alcohol swab. It always has to be a blunt needle. You're putting it in the little collector right here. So then you're drawing back. So typically, we always tell you to get the full 10 cc's, because remember, you've got to send your BMP, your CBC, and your coag, and you've got to run a Chem 8, okay? So just always make sure you try to get at least 10 cc's, okay? At this time too, respiratory is here, and they'll draw their ABG right after you're done. So once you're done and you're getting ready to withdraw your syringe, always kind of pull back on your syringe and come out. So once you do that, you don't make a mess. Remember, this is an arterial line, so there's a pressure gradient on this as well. So you don't make a mess once you do that, okay? Then you go back to your little flush, you turn it on to your patient, and then you push this back into the patient, the blood back into the patient. It will click. Once you hear it click, then you're ready to flush your line. So always make sure that when you get ready to flush your line, that your line is clear all the way over to your patient's arm. You don't want to leave blood sitting in that tubing, because it will clot off. We no longer put heparin in our flush systems, so just remember to make sure that you're always flushing it. And you're pulling your little blue pigtail right here in order to flush the line appropriately, okay? So now we're done. The secondary person will send your lab off. After that's done, make sure you check your NG tube, and then x-rays should be arriving at this point in time to shoot your x-rays. Make sure that you let them know you need to be able to see where the NG tube is, and Dr. Hoffman will usually hear and look at it for you as well.